How's it going? My name is Fahim, and I'll be doing an IM injection today for an adult. So the first thing I'm going to do is wash my hands, hand hygiene. It's very important. So then I'm going to arrange the correct supplies for IM injections. Usually it's just the 2x2 gauze. Look for the right needle, so I'm looking for a 3 ml syringe. I'm looking for a 23 gauge. So that's what I got right here, alright? Perfect, just what I need. And I'm also looking for some gloves for later. Alrighty, and I'm gonna look for the alcohol prep pads, the isopropyl alcohol, 70%. Okay, and now I'm gonna come to my MAR and see what I need, or my order sheet actually, and see what I need. So the order calls for Bacillin, 2.4 million units, IM. So I'm going to look in the drawer. I'm going to open it. I'm going to look for Bacillin. Found Bacillin. So our hospital carries it in 2 million units. So yeah, the order calls for 2.4 million units. We have 2 million units. So to calculate, I have to get it into volume, which the volume is mLs. And that'll come out to 1.2 mLs of Bacillin. Alright, so I'm going to compare the drug to the MAR in the order form. So let's see, Bacillin, and the guy is Charles Kamang. Okay, the right dose, 2.4 mLs, 2.4. The right route, I mean not 2.4 mLs, 2.4 million units. The right route is IM, and we're going to do the, for site, it's going to be the ventrogluteal. And let's see, the time is now, which is 9 a.m. And the expiration date, I'm going to note, expires in March 5th, 2015. Okay. What else do we need to do? Alrighty, so got all the right med, dose, route, time. The right reason for this is for the Lyme disease. And the right response we're going to note later on. Okay, so the first thing I want to do, open up my med, use my first, because I get 2 alcohol pads, I'm going to use one first. I'm going to clean out the top of this. Okay. So like I said earlier, I'm going to drop 1.2 mLs of Bacillin. Before I do that though, I might want to do another check. So we got the right name, Charles Kamang, the right med, Bacillin, the right dose, 2.4 million units, the right route is IM, and the right, what else? We got the right time, which is 9 a.m. And the right, reason and response will be later. Open this up. Careful not to touch the insides. Alrighty. I already cleaned it off. So actually, first I want to aspirate some air. So it's going to be 1.2 mLs. Okay. Put the air in there. And now pull back. Make sure I don't want any air bubbles. And flick it to the top. Alright, awesome. Get that. It's already drawn up, so now I just want to lift the cover on the needle so I don't accidentally poke myself. Okay. Okay, now all my materials are set up. And before I put this medication back, I want to do the third check. So I got the Bacillin, the right person, it's going to be Charles Kamang. The right dose, which is 1.2 mLs in my calculations, but this is 2 million units. So the right root is IM in the vast ventrogluteal site. The right time is 9 a.m. It's 9 a.m. right now. The right reason and response are going to be later, but the reason for it is the Lyme disease. Okay, so now I'm going to put it back, lock my cart. Oh yeah, obviously, I noted the expiration date too, like I said earlier. Lock the cart. Or disposing, whatever it calls for. Alrighty, and now I'm ready to deliver my medication. Thank you. Knock, knock. Hello, sir. How's it going today? I'm Fahim. I'm going to be a student. I'm your student nurse today. Can I get your first and last name, please, and your date of birth? I'm just going to check your ID band real quick. Actually, I'll come over here because that's kind of awkward. All right, first and last name. Charles Mang. What's your date of birth? Awesome, January 1st, okay, thank you. So it's January 1st, 1947. Alrighty, so I'm here to give you your Bacillin injection today. It's intramuscular. It's for the Lyme disease. Is that okay? Okay. Now I'm going to come over and wash my hands. Hand hygiene is very important. Put on some gloves. Alright, so I'm going to get all my supplies. Anyways, alright, over here. Anyways, alright. So I'm gonna look at your I'm gonna locate the ventrogluteal site. So I'm gonna come over here. Assistant, can you come over here please so the camera can see what I'm doing? You put the camera on the site. So I'm gonna take the top of my fingers and locate the iliac crest. And the heel of my hand is going to be over the greater trochanter. Okay, and I'm a lefty, so this is my dominant hand. It's going to be over the greater trochanter of the hip. My thumb's going to be towards his symphysis pubis, and my index finger is going to be towards the anterior superior spine site. And then the injection site is going to be between these two fingers, the first two fingers. So it's going to be like right in the middle. Right there, okay? So what I want to do first, use my alcohol prep pad. I'm going to clean off that site. So, okay, I'm going to allow it to dry real quick. I'm looking at my medication. She dropped his skin. I'm going to look at the medication. And it's 1.2 mLs, just making sure I have the right amount. Can you point to the skin again, please? Alrighty, so I allowed it to dry. So I'm going to uncap the syringe correctly. Okay. Now it's dried up, and now I'm going to find my markers again. I'm going to inject at a 90-degree angle. Okay. I'm going to aspirate to make sure there's no blood, because if there is, it's in the blood vessel, and that's not what you want. You got to start right over. I'm going to inject now. Nice and slow. You don't have to go fast. Release. Cap the syringe. Put the gauze over it. Just let it. No rubbing it around, just gentle pressure. Put it into the sharps container. Kobe! Oh, alright. That's done. And then, so, All right, sir, so I'm going to come back in about 15 to 20 minutes to check on how you're doing. Okay, and now I'm going to remove my gloves. So I'm going to come back to observe the response, make sure there's no irritation. I'm going to cover him back up. I'm going to go now and document. So what I want to document is the med name, his name, the date, time, the dose, the route, the site too, obviously. And then that's pretty much, the right reason, the right response for what I wanted. So, and that's pretty much all. Have a great day.